Hi there, and thank you so much for joining me for this video. So this video is going to start our discussion of validity, which is the topic for Module 5. So last week in Module 4, we talked a lot about reliability. So as you may recall, reliability is essentially an index of how consistent your measurement instrument is, right? So for example, let's say you were trying to measure intelligence, okay? And you decided to measure intelligence by looking at the circumference of your head, right? So to measure the circumference of your head, you simply used a tape measure, okay? And every time you used a tape measure to measure the circumference of your head, you got the same measurement, okay? So we would say that using a tape measure to measure the circumference of the head is a highly consistent measure or a reliable measure, right? So you get the same number over and over and over again, no matter how many times you collect it, right? So that suggests that your instrument, your measurement instrument, is reliable, okay? But what we're going to talk about now is the validity of your measurement instrument or your questionnaire or whatever it might be, okay? So validity is going to be concerned with accuracy, right? So instead of asking if our test consistently measures the same thing, we're going to be asking if our test measures what we purport it to be measuring or what we think it's measuring, right? And I think we can all agree, right, that the circumference of the head is probably not a good index of intelligence, right? So what we have here is a very reliable or consistent test or instrument, but not a very valid one, right? And we could say the same thing of standard intelligence tests, right? So for example, maybe you construct a questionnaire that measures intelligence, and your sample of participants get the same score every time they take the test, right? So again, that suggests that your measure is consistent. However, there are other possibilities as to what your test might be measuring besides intelligence, right? So for example, maybe your test is measuring something like reading comprehension, right? If you have a lot of passages that participants have to read and answer questions about, maybe your test is giving you an index not of intelligence, but simply their ability to remember the things that they've read about in those passages, right? Or similarly, maybe if you give them a lot of very complex mathematical or spatial problems, right? Maybe they're doing well on that test because they have a longer attention span than most people, right? So they're able to focus on the task longer than other people are able to, right? So these are all questions of validity, right? So the idea is my intelligence test really measuring what I want it to measure, or is it measuring something else? Okay. Okay, so now we're going to talk about different types of validity, right? So just like with reliability, we had a bunch of different tests we could use. There are many different types of validity that we can measure when we're looking at a questionnaire or a test or whatever our measurement instrument might be. So construct validity is just a very broad general term. And essentially what we ask when we're talking about construct validity is simply, is my test measuring what I say it's measuring, right? So all of the previous examples I gave you are questions of construct validity. Right? So maybe one of the easiest ways to assess construct validity might simply be to look at a test and say, okay, what is this particular test measuring? But for a lot of psychological constructs, simply looking at a test won't necessarily be an obvious indicator of what it's measuring. So let me show you some examples. Okay, so example number 1, what is this test measuring, right? So let's look at a couple of questions here. A person needs to show off a little now and then, right? And by the way, these are yes or no questions or agreement questions where you would say, strongly agree, strongly disagree, etc. Here's another question. People today have forgotten how to feel properly ashamed of themselves, and I prefer a shower to a bathtub, right? So simply looking at those questions, do you have a sense of what this test might be measuring, right? Probably not unless you've seen this particular test before, right? Similarly, I daydream and fantasize with some regularity about things that might happen to me. Or becoming extremely involved in a good book or movie is somewhat rare for me. Or I am usually pretty effective in dealing with emergencies, right? So just by looking at these tests, right, they're fairly ambiguous. It's not entirely clear what they're measuring, okay? So it turns out that both of these tests are actually looking at empathy, okay? So the first one I showed you was the Hogan Empathy Scale. And the second one that you're looking at right now in this slide is the Interpersonal Reactivity Index. So both of these are tests that attempt to measure empathy. So the particular type of construct validity that we just attempted to use by simply looking at the test and trying to see what it's measuring is called face validity, right? So essentially what we're asking with this type of construct validity is, does the test appear to measure what it's intending to measure? And as you could see from our previous examples, right, is that this is much more difficult to do than you would think, particularly for psychological constructs. So this is going to be the least important or least precise form of validity that we can use because many good measures or many common measures in psychology are not obviously measuring what they intend to measure, just at first glance, right? So for example, sometimes we intentionally use filler items to kind of throw our respondents off of our trail, so to speak. So if they were to try to guess what we're measuring, they wouldn't be able to. And we also measure a variety of implicit constructs or things that aren't going to be immediately obvious or declarative for our respondents, right? Are things that are kind of below their level of awareness, not necessarily in a Freudian sense, but just things that they're not explicitly aware of, okay? So for example, with the TAT or the thematic apperception test, what we're looking at in this case is signs of bias, right? Often racial bias. But when respondents are taking the test, right, that's not immediately obvious to them, okay? So if we can't just look at our questionnaire or our measurement instrument and determine what it's measuring, right? How can we assess whether our construct or our questionnaire measuring our construct is valid, right? So for example, if we were developing a questionnaire to measure extroversion, and we can't just look at the items on a test to see if it's obviously measuring that construct, what can we do, right? So if we can't just look at a test, how can we determine if our measure is measuring what we want it to measure? Okay. Well, one of the things we can do is we can assess our questionnaire using what's called criterion-related validity. So criterion-related validity is going to compare scores on our measure or our questionnaire to some other standard. Okay, so we're going to compare respondents' answers or scores on our measure to some other standard, right? And there are multiple types of criterion-related validity, so let's look at them together. Okay, first we have convergent validity. So with convergent validity, essentially what we're trying to assess is if scores on our measure correlate appropriately with other related measures. Okay, so for example, let's say we are developing a new questionnaire that indexes level of depression, right? So we're developing a new depression questionnaire, okay? So what are some related measures that might yield a positive correlation? Okay, so we have our depression instrument, and for example, hopelessness, anxiety, sadness. Okay, so we would compare scores on our new depression questionnaire to scores on other questionnaires measuring similar or related constructs, right? So we would expect to see a positive correlation between depression score and maybe other questionnaires looking at things like anxiety, sadness, hopelessness, etc. Okay? And we could do the same thing, except maybe looking for a negative correlation. Right? So we would expect a negative correlation between things like self-esteem, life satisfaction, happiness, etc. Right? Because those are kind of predictable relationships between variables, right? We would expect something that's related to depression to positively correlate with our measurement instrument. And we would expect a negative correlation between our depression questionnaire and sort of inverse things, right? So somebody who scores high on a depression scale is likely to have low self-esteem, low life satisfaction, and low happiness scores, right? Okay, so our next type of criterion-related validity is going to be something called concurrent validity. Okay, so in this case, we're going to compare our scores on our measurement instrument with another measure of the same construct. Okay, so for example, we might compare our depression questionnaire to, or a new depression questionnaire to something that's established for measuring depression, right? So we might compare our new depression questionnaire to scores on the Beck Depression Inventory, or the BDI, for example, right? Because the BDI is a well-established measurement instrument that also looks at depression, right? Or if we're developing a new questionnaire measuring extroversion, then we would see if there was a correlation between our extroversion questionnaire and some established measure of extroversion, like the NEOPI, for example, which is a personality test that looks at extroversion. Okay, so whereas convergent is looking at different constructs that are related to our construct, concurrent validity is looking at measurements of the same construct, or measurement instruments or questionnaires that are looking at the same construct. Okay. And next we have another form of criterion-related validity is discriminant validity, right? So what does discriminant validity mean? Well, it means, or it looks at whether our scores on our new measurement instrument do not correlate with other unrelated measures. Okay, so we want to make sure that scores on our new questionnaire don't correlate with other unrelated measures. Okay, so let's look at some examples. Okay, so in particular, we are expecting a zero correlation here. And why is that? So let's take our depression questionnaire that we are developing, our new questionnaire that measures depression. If we found a correlation between depression and something totally different from depression or totally unrelated, right? So, for example, if we obtained a positive correlation between our depression score and reading comprehension or mathematical ability or spatial rotation, right? So if we found that people who were very good at these things, at these particular skills, were also scoring very highly on our measurement instrument, okay, then that might indicate that we're not really measuring depression, right? Maybe we're measuring some other more cognitive variable, right? So regardless of whether we found a positive or negative correlation between our alleged depression questionnaire and a spatial rotation measure, then that would indicate to us that we're looking at something other than depression, or that our measurement instrument wasn't actually measuring depression, but looking at maybe some generalized intelligence or some sort of higher level cognitive ability rather than depression. Okay? So far with criterion-related validity, when we look at convergent validity, we want to make sure that we see either a positive or negative correlation in the expected direction, right? So we would expect a negative correlation between our depression score and, for example, self-esteem or life satisfaction, and a positive correlation between our depression score and sadness or hopelessness, right? And with concurrent validity, we would expect a positive correlation between our depression score and some established depression questionnaire score, like the Beck Depression Inventory, for example. And then with discriminant validity, that's just another way of making sure that we are measuring depression and only depression, right? So with discriminant validity, if we found a positive or negative correlation between our depression score and some totally unrelated construct like handedness or mathematical ability, okay, then that would indicate that some of the items on our depression scale that we've developed are measuring something besides depression. Okay, so another kind of construct or criterion related validity is predictive validity, okay? And that's just what it sounds like. So with predictive validity, we are asking whether the scores on our new measurement instrument predict some future outcome. Okay? So for example, a patient's score on your depression inventory might predict hours slept or work days missed at a later point, right? Similarly, if we were developing a new measurement instrument for aggression, then we would expect our aggression score to predict number of future playground altercations, if we're looking at aggression in children, for example. Similarly, if we developed a questionnaire, a new questionnaire measuring extroversion, we would expect scores on this questionnaire to be able to predict the number of people interacted with per day at some point in the future. And a really well-established example of predictive validity is the SAT, or the Scholastic Aptitude Test. Really predicts really well a lot of future scores. Okay, so for example, the SAT predicts freshman GPA. Okay, so that's one of the many reasons why colleges and universities use the SAT, because scores on this measure are going to predict how well that particular student does during their first year of college. Okay. Okay. So another type of validity that we can use to assess our new measurement instrument is evidence from distinct groups. So what do I mean by evidence from distinct groups? Essentially, depending on what our questionnaire is measuring, we might have an a priori expectation that specific groups of people should score differently on our measure. Okay? And so what we can do with by establishing evidence from distinct groups is we can test to see if you get the predicted outcome. So for example, if you've developed a construct looking at political attitudes, you could give your survey to people at the Democratic and Republican national conventions and see if they score differently on your measure. Okay. Similarly, if you've developed an instrument looking at depression, you could give the questionnaire to people who are seeking treatment for depression and also control participants that are not suffering from depression, and see if their scores are different. Okay. So another type of validity that you can look at is content validity, which essentially assesses whether items on your test or your measurement instrument are appropriately covering all of the various aspects of the intended construct. Right? So let me show you an example. Okay, so we know, clinical psychologists know, that there are many different facets of depression, or there are many different types of symptoms that arise during a depressive episode, right? So for example, depression can cause disruption in normal sleep cycles and eating habits. You can experience social isolation while you're depressed, right? So for example, you would want to determine whether you have items on your questionnaire, your depression questionnaire, that cover all of these aspects, right? So for example, what if you have questions about eating and sleeping disruption and dysphoria, but you don't have any questions about social isolation? That would suggest that your test is lacking in content validity. Another type of validity you can use um, to assess your questionnaire is something called factor analysis. So factor analysis essentially looks to see if there are clusters of items on which your respondents are going to score similarly. And if there are clusters of items that respondents score similarly on, that can help you find subscales or subdomains of your construct, right? So for example, if you do factor analysis and you find that your respondents score high on item number 1, and they also score highly for 4, 5, 8, and 13, right? That would be good evidence to conclude that that might represent a subscale, right? And similarly, if they score high on question number 2 and also 3, 6, 7, 12, and 14, okay, that would also be good evidence of a subscale, okay? So essentially what factor analysis does is it helps you identify particular subscales or subdomains of your questionnaire that respondents are sort of answering similarly to, right? And there's two types of factor analysis. There's exploratory factor analysis, where you have no a priori or no predictions beforehand. Okay, so going into it, you have no expectation that particular items will correlate together, or you have no predictions, but you just want to see if there might be particular subscales. Confirmatory factor analysis is where you do have specific expectations. Okay, so for example, if you were measuring depression, like we were just talking about, then you might expect to have specific factors that correspond to all of those components. So for example, factor 1 might indicate dysphoria, factor 2 might indicate eating, factor 3 might indicate sleeping behavior, and factor 4 might indicate social isolation, right? So if that were the case, we would expect these factors or subscales, right, to be focusing on that particular aspect of depression, whether it be social isolation, eating or sleeping behaviors, etc. Okay? All right, so the very last thing I want to talk about in this video is the relationship between reliability and validity. So reliability is a necessary but not sufficient criteria for validity or condition for validity, right? So why is reliability necessary in order for a particular test or questionnaire to be considered valid, right? Well, let's suppose I have a new measurement instrument or test looking at intelligence, right? Well, if I get a vastly different IQ score from a respondent every time I give them my IQ test, right, then obviously I'm not measuring IQ, right? And we know this because IQ is a stable trait, or it's fixed, so we wouldn't expect it to fluctuate every time the respondent takes the test, right? So if it's not reliable, right, then it's very unlikely that it's also accurately measuring what we want to measure. It's very possible that if it fluctuates to this degree, we're not actually measuring intelligence, but rather something like alertness, for example, or how well someone is able to focus or pay attention to the questions at that particular time, right? And similarly, if I were to devise a new questionnaire measuring depression, right? If I were to use the split halves reliability test, right? And all of the odd items say that the respondent is depressed, but the even items say that they're not, okay? Then obviously this is not a valid measure of depression, right? Because both or all of the items should yield similar scores, okay? And if they don't, then obviously those odd items are measuring a different construct besides depression, right? So again, reliability is a necessary but not sufficient criterion or condition for validity. In order for a test to be valid, it must first be reliable, or if a test is not reliable, it is also not valid. Okay. Similarly, reliability is not a sufficient condition for validity, right? So reliability is necessary, but it's not sufficient, a sufficient condition for validity, right? So what do I mean by that? Well, just because our measure is reliable doesn't necessarily guarantee that it's valid, because you can very consistently measure the wrong thing, right? So the example that I first used of using a tape measure to measure the circumference of the head, right? You could get the same measure every single time, and in fact, I would expect you to do so. But just because that measure is consistent doesn't mean that the circumference of the head is a valid measure of intelligence, right? So just because we have reliability doesn't necessarily mean we have validity. Okay, so a couple other examples, right? If your speedometer on your vehicle is consistently measuring 5 miles an hour below reality, right? So similarly, if you set your scale so that you're always 5 pounds over your actual weight, that's going to be a very reliable or consistent measure, okay? But it's not going to be an accurate measure of your weight or your speed, right? And like I said before, if you're developing an intelligence test that has a bunch of reading comprehension problems, right, it's likely that people should score very consistently on that. But that's not necessarily the same thing as IQ, right? Okay, so again, reliability is necessary in order for a measurement to be valid, but it's not sufficient for validity, because it's very possible to get a measurement instrument that is highly consistent, but consistency doesn't necessarily guarantee validity, right? Because it's possible to very consistently measure the entirely incorrect construct, right? Okay, so that concludes our first video for Module 5, which is looking at validity. So I hope you have a wonderful day, and I will see you in my next video.